Hi guys, welcome. It has been a little while since we've done one of these, so it's nice to be back. And today we're going to talk about regaining control. So we actually did a poll right in our own group here about what the worst thing was having a bladder problem. And we looked at, was it trouble having sleep? Was it actually wearing pads? Was it going out in public? Or was it just feeling out of control? And so this is the number one problem that people complained about with a bladder issue is they just don't feel in control. And that obviously robs your quality of life and really, cuts that out. So we're going to talk about, and the research really has shown the same thing. So this is not a surprise for anybody who's dealing with a bladder issue. And unfortunately, oftentimes what happens with a bladder issue is basically you are not in control, and your body is telling you, and this is the condition that we call overactive bladder, but your body is telling you, hey, you have to go, and it's frequently. And so oftentimes people are struggling because they might be needing or wanting to use the bathroom every single hour. Oftentimes that equates to not sleeping well at nighttime because they also might get up frequently at nighttime. And so one of the fun things that we do in our practice is help people with each one of these things. But basically, overactive bladder is made up of a cluster of symptoms. Frequency that we just mentioned, and really that's more than 8 times in a 24-hour period. Nocturia, or waking up at nighttime to go to the bathroom, and generally that's more than 1 times per night is considered abnormal. Urgency, and that's having the very strong desire to use the bathroom whenever you have to go. And it's interesting because some people will have urgency only in the day or only at nighttime, and then a lot of people actually have urgency kind of all of the time. And then the final one is incontinence. And so that's the cluster of symptoms that make up this condition called overactive bladder. And so many people have each one of those things. There are also people who don't have incontinence, but they have the other ones, or there are people with just nocturia where they're getting up all the time at night. So there are lots of variations of this. And so for most people, because it robs their quality of life, for most people, having this condition, overactive bladder, has a terrible impact on your overall health, on the way that you view yourself, the ability, and a lot of quality of life comes down to how much control you feel like you have over your life. So when you feel like you're out of control completely, quality of life really begins to tank. And there's actually some good research on that, and even some psychological aspect to that. And one of the books that I've actually talked about on here before is Man's Search for Meaning, Viktor Frankl, and he was a psychiatrist who was in the Holocaust, and he survived that. But one of the things he did that was interesting is he tried to figure out why some people would live through a scenario and why some people would die. And what he found is, and obviously that's not in those people's control oftentimes, but what he found is oftentimes the survivors had a reason for living. So even though they weren't in control of almost anything at all, they felt like they could be in control of their own thoughts and their reason for living. And what he found is the people who didn't have a reason for living, and it might be as simple as, I want to go for a run sometime, or I want to see my family again, or I want to, eat a fine meal, or whatever it might have been. It didn't matter what the reason was, but you had to have a reason why you wanted to be alive. And so one of the things that I think we learned from that is there are obviously things that are outside of our control that we can't do anything about, but we can control our own thoughts. And so one of the ideas that I have on this is to give you a few kind of hints or suggestions that might help you to control your bladder a little bit more, or at least control the way that you think about that. So without further ado, well, I'll also mention the research. There's research that shows if you have a bladder condition like this, um, it affects your quality of life the same as if you had a debilitating condition like rheumatoid arthritis, where you have pain in all of your joints. And rheumatoid arthritis oftentimes will affect the small joints, like joints in your hands, in your wrists, but it can affect the larger joints too, like your knees, your shoulders, your elbows. And so it can be a disfiguring condition, but also very, very limiting because you have pain to move. And so oftentimes those people begin moving less and less and staying more and more immobile. But the research basically shows that people with overactive bladder have the same level of, it's affecting their quality of life, the same as if you had really bad rheumatoid arthritis. And so I think that's actually, one of the reasons why it's so important for people to try and regain control. So the first thing I'm going to say is, I don't know if there is a silver bullet to regaining control of your bladder, but I think there are some things that have actually shown some significant benefit, and I would like to talk about those things. Many of you guys already know this, but I specialize in a technology called sacral neuromodulation, or called bladder stimulation. And that technology is basically the best researched, most successful thing that's ever come out for people who are struggling with this condition called overactive bladder. Having said that, it's actually the most advanced thing, and in order to qualify for that, oftentimes you have to have tried some other things. So let's talk about some of those other things, but I also want to focus on what can each of us do to make ourselves healthier, because at the end of the day, that really is the ultimate goal. So, one of the things that I think everybody with a bladder problem should do is probably daily Kegel exercises. And so, Kegel exercises, again, the idea is just to strengthen those pelvic floor muscles. And really it's contracting and relaxing the pelvic floor muscles. Men and women can do it. Anybody can do it. There are some other exercises that also I think would be beneficial. So if you're struggling with a bladder issue, I think strengthening the pelvic floor will only make you overall a healthier person and help you to control your bladder more. Now, having said that, what's interesting is this is the first thing that almost everybody recommends. If you dive down into the research, there's actually fairly good research for strengthening the pelvic floor muscles if you have what's called stress incontinence. And stress incontinence is a muscular problem. If you laugh, cough, or sneeze and you have leakage of urine, that's stress incontinence. It's more common in women, especially after childbearing. It is also associated with hormonal changes that can occur. And those obviously occur during pregnancy, during menopause, and then a monthly cycle for a woman, you have these big hormonal changes. So Kegel exercises, I think, can be very valuable. If you look at Kegel exercises for overactive bladder, we believe is more of a nerve issue. So the nerves in the bladder aren't connecting as well with the brain, and so we have kind of a disconnect that occurs. Pelvic floor muscles strengthening has been researched in a few different studies, but it looks like it's actually more effective for the muscular problem, which makes sense, and maybe less effective for the nerve problem. Having said that, it's conservative therapy. You're not going to harm yourself trying those things, and I think it should only give you better control over your bladder. So again, it is certainly not a silver bullet, but I think it only makes sense. So all of us, part of healthy, I would say, aging is to try and work on our muscular strength. Another one is lifestyle and dietary modifications. I think these things can take you to a certain level, but beyond that don't really help you. But I do think those things are valuable. And so the things that are commonly recommended is to avoid triggers. And so for a lot of people, triggers that irritate the bladder, or caffeine, alcohol, sometimes spicy foods and artificial sweeteners, those things are triggers, and if those are triggers for you, then you should avoid those triggers. And I do think it's worthwhile to play around with your diet, play around with how much fluid you're drinking, those kinds of things, and see if you can have an improvement. What I think is actually probably even more beneficial for most people, that's not commonly talked about, is really the underlying cause why we're getting this bladder condition is because we have nerve inflammation or nerve damage, and that comes from something called oxidative stress. And so this is kind of new research that's coming out in the bladder world. And so one of the things that I think is healthy is to try an anti-inflammatory diet. And so some of the ones that are being studied and are really valuable now are like the anti-inflammatory ketogenic diet. So sugar itself or even insulin can damage nerves. We know that pretty well from diabetics. And so if we can lower insulin levels and sugar levels, that may help to prevent damage or inflammation of these nerves. There is a condition called metabolic syndrome, which is extremely common in America, and it's basically the precursor to diabetes. And so metabolic syndrome, there's a really strong correlation with metabolic syndrome, which is essentially insulin resistance, or you're eating too much carbohydrates or sugar in your diet, and that's been going on for too long. And so it's the combination of that, and it's kind of a pre-diabetic issue, but there's a really strong correlation with insulin resistance, metabolic syndrome, and overactive bladder. There's also a strong correlation because these nerves are very, very sensitive in the bladder and going from the bladder up to the brain. We need to try and do everything we can to protect or heal those, but there's a strong correlation with metabolic syndrome and dementia, which we think is, they're calling that type 3 diabetes now. But we know that those higher blood sugars or insulin levels are damaging the brain, and the brain's not able to clean itself out. We also see an increased risk of dementia with bladder problems because of sleep problems. So remember, the underlying issue that we think is causing damage to these nerves, this oxidative stress, it's affecting the nerves, but your brain is like a big nerve, and eventually it affects your brain. If it's causing you to wake up frequently at nighttime, you're missing out on restorative sleep, and therefore you are predisposed to have cardiovascular disease, heart attacks, strokes, and dementia. So all kind of bad news. So one of the reasons we want to really work on some of these lifestyle modifications. So I would say ketogenic diet. I think there's some interesting things coming out on seed oils, and seed oils are like canola oil. And so basically there's two good oils, and it's avocado oil and olive oil. But what we're finding about these seed oils is previously they were used for machines to make machines operate, and then they've been introduced basically into our diet in the last, let's say, 100 years, and they're in every single kind of processed foods. But what we know about these seed oils is they really increase that oxidative stress, and they stay in your body for a couple of years. Your body cannot metabolize them. It wasn't made to metabolize them. On the other hand, your body can metabolize animal fats like butter or ghee or tallow. And so I recommend those instead of seed oil. So just cleaning up your diet, eating natural, wholer foods. I think if you wanted to do a ketogenic diet, I think there's actually really great emerging research on that. Not so much yet for the bladder, but I think that will likely be coming. So dietary modifications I think are important. I always mention that there are some supplements that have been shown to be effective for bladder issues. And the two big ones that really kind of show the most promise that I think every person with a bladder problem should be on are vitamin D3, and you can get it with K2. And so both of those things have been shown to calm down inflammation and are neuroprotective, or they're good for your nerves. The other supplement that I always recommend is magnesium. And most women should be on at least 400 milligrams of magnesium at night, and men should be on 500. Magnesium is a smooth muscle relaxant. It's also a cofactor used in thousands of different interactions in the body, so it's really, really important. But it's actually probably the number one anti-aging supplement that you can take. And both of those two things, vitamin D3 and magnesium, work with your body to try and decrease the inflammation that you have. So those would be things that I certainly would recommend and have been shown promise for in research for bladder problems. Okay, so let us look at, what are some other things. I would say other things, medications, we've talked about this a lot in the past, but what about medications for bladder problems? Isn't that something that everyone should be on if you have a bladder issue? Short answer is no. The longer answer is most of the medications, the ones that are generic, drastically increase your risk of dementia by about 150%, and they increase your risk of being dizzy, being confused, and having falls, which ends up being one of the big killers for most of us as we age. So we would like to avoid any of those kinds of side effects. And again, those are the generic bladder medications. They're also not terribly effective, and there's a lot of research that goes and looks at this, but they basically are effective for about 1 in 8 people. Effective just means they decrease your symptoms, but they obviously cause some other problems, so they have a lot of side effects. There are 2 newer bladder medications, Gymtesa and Myrbetriq, and they're actually much more selective, so they actually have less of those problems. We don't think they lead directly to dementia. We don't think that they increase your risk of falling. They do have some other risk and generally have some cardiovascular issues. Having said that, if you were going to be on a bladder medication for the rest of your life, those would be the 2 that I think would make the most sense because the other ones dramatically increase your risk of dementia. Those medicines unfortunately end up being very expensive. For most people, they're not terribly effective. They usually end up working for about 1 in 8 people. So they're not terribly effective, they're expensive, but they have less side effects. So that's kind of the pros and the cons of those. If physical therapy or pelvic floor therapy might give you some relief, so that's something I encourage. Dietary changes might give you some relief. But remember, if you're having some neurological issues, which is overactive bladder, these probably came about over years and years, and the number one risk factor for all of us is just plain old aging. As we get older, those nerves don't quite work as well, and one of the ideas on aging at this point is called inflammaging, where just inflammation, your body's not able to handle that. So I think an anti-inflammatory lifestyle is a really great idea. What else can be done? Botox within the bladder is commonly done. There are certainly some benefits to that, and then there are some risk of that. Botox takes about 30 minutes to perform. I think it's probably best if you do that with sedation. Botox is injected into the urethra, into your bladder, in 20 different spots in your bladder. Generally, it lasts for most people for 3 to 6 months. Botox is botulinum toxin. It's a neurotoxin, so it basically kills the nerves that are in there. We already said these nerves are already kind of damaged or inflamed. This kills the nerves, which relaxes the muscles, and that's why people use it in their face to kind of take away wrinkles and that kind of thing. It has shown to be effective. It is not quite as effective as the therapy that I'll talk to you about next. And then it really runs the risk of urinary retention, where your the bladder is a muscle that needs to contract to get the urine out. And if you put too much Botox there, you can get what's called urinary retention, and the bladder can't contract in a coordinated way. So that's the kind of significant risk with that procedure, I would say. The most successful thing that's ever been designed or developed is called sacral neuromodulation. There's 2 companies that make this technology. Medtronic came out with it 25 years ago. That's commonly called InterStim. The InSight trial, which is the InterStim Medtronic trial, showed that 61% of patients experience at least 50% relief in overactive bladder. So, that's not bad, but it's also not great. 86% of people reported some improvements in their bladder. The technology that basically I have focused on is a newer company that came out about 4 years ago. They changed the landscape for this thing called sacral neuromodulation or bladder stimulation. The company's name is called Axonics. They're in the process right now of being bought by Boston Scientific, but they've been out for a little over 4 years. And what their research study showed is 94% of people experience more than 50% relief. And so again, the Medtronic study showed 61% of people experience more than 50% relief. The Axonic study showed 94% of people experience that much relief. So just there you can see that there's like kind of a difference in this technology, that there's something special about it. The average person who gets this therapy gets about 75% improvements in their overall symptoms. And the symptoms that we care about are the same ones you care about. So number one, people with this therapy feel like they get their life back, like they're in control again. So they feel like now their bladder was controlling them. Their bladder was dictating when you had to go, when you had to sleep, when you got up, where you could travel, all sorts of things. Now people with this technology feel like they're back in control. So the average person gets about 75% improvement. I just took care of a doctor this past week. So he was getting up, I think, 9 times a night. With this technology, when we tried it out, there's 2 steps to this technology: to try it and see if it works for you. If it does, to implant the technology. When he tried it out, he was getting up once a night. So you can imagine how his quality of life will be different just as a result of this technology. And so, obviously was a successful trial, and about 90% of people or more have success with that trial and then want the implanted procedure. That implanted procedure lasts for about 20 years, so it just keeps working and working and working. Why, you might ask, is this the most successful thing, or why is it better than, let's say, medications or therapy or anything else really? The reason is because it's working on the underlying problem. So remember, the underlying problem is the nerves are inflamed or damaged, and they're not conducting as well as they used to. What this does is it applies a little electrical energy right by the tailbone area, and it opens back up that pathway between the bladder and the brain. The same exact technology also works for some bowel problems, including fecal incontinence. So there are some people who have both bladder and bowel issues, and this kind of becomes a 2-for-1. So I'm going to finish up our little discussion today. Things that I think you could do to improve your quality of life and to help you get back in control of your bladder. I would say everyone should do some daily pelvic floor kind of work, because strengthening those muscles and tissues, I think, only has the potential to help you and will not harm you. And so I just think it's a good practice to do those things. I would say, all the patients that I end up treating, none of them have really benefited from that, but it still is a good practice to do. And even after the therapy that I use, I still encourage people to do that. Lifestyle modifications, and really I think that comes down to diet. I talked to you about vegetable oils or seed oils and trying to get those out of your food, trying not to cook with those things. Those things appear to be very damaging to nerves, and they just cause oxidative stress, or stress inside your body that's inflaming or damaging different structures in your body. So I think it's much better to use things like butter. If you need to use oil, olive oil and avocado oil are better choices. I think your body was designed to use and to eat up butter, tallow, ghee, lard. All of those things, kind of what our ancestors used, that's what our body was designed to use. Beyond that, I think there's a few supplements that every person with a bladder issue should be on. And vitamin D has been very well studied, and magnesium. And so those are 2 that I always recommend. There might be some other ones that you could think about. There's some research on vitamin C, which obviously is an antioxidant or anti-inflammatory at the cellular level. I think that would be a smart choice as well. And then when you get into actually treating things, medications, if they work for you, great. I would not want to be on, or have my wife or my parents or anyone I loved about, or really anybody, on the older medications just because they drastically increase your risk of dementia. And so I would say try and avoid those ones if at all possible. Oftentimes I will see people and they'll say, oh yeah, I've been taking this medicine for 10 years. It really hasn't worked. And I'm also developing some like early dementia. And that's just a really bad combination. They're not very effective. So if you have to be on one of those medicines, maybe be on one of the newer ones and hopefully it'll work for you. If you're looking for the most successful, most studied, research thing, there certainly is nothing better at this time than what's called sacral neuromodulation. And the technology that I recommend and that I specialize in is called Axonics, Axonics. If you want to check out their website and kind of read through the research studies. 94% of people had over 50% relief of their symptoms with that technology. And that looks at those people over a couple of years. The average person gets about 75% relief. And so for most people, that ends up being completely life-changing and really gets you back in the driver's seat and in control. Even with that technology, I still think people should undergo some changes in their lifestyle, all the other things that we talked about. Okay, I think that is all for today. If you guys have any questions, please ask them below, and I'd love to answer any of those. And God bless you guys. Have a wonderful rest of the week. Thanks so much.